Hey guys, the condition that I'm going to go over today is complex trauma. Trauma is a word utilized to refer to emotional shock following a stressful event or an experience that is deeply distressing. In 2013, the DSM-5 established post-traumatic stress disorder for children 6 years and younger under the classification of a trauma and stressor-related disorder. The qualifications required to diagnose a child with PTSD includes experiencing, witnessing, or learning about death, violence, or injury, especially toward a caregiver. After the traumatic event, they may begin experiencing intrusive thoughts, avoidance, or negative emotional reactions from reminders of the trauma. This typically goes hand in hand with physiological dysregulation, for example, sleep disturbances, hypervigilance, concentration difficulties, and angry outbursts. The etiology and risk factors for this condition are numerous. This condition is a result of exposure to traumatic events, maltreatment, or polyvictimization beginning in early childhood. These events occur in the context of being unpredictable, uncontrollable, and violent environments in conjunction with inconsistent or absent protective caregiving. This tends to occur in a transgenerational movement, meaning that the offenders have also experienced trauma in the past. As stated, there are many risk factors, but just to name a few, there are having young and or single parents, low SES, diagnosis of psychiatric disorders, substance abuse, and the child having a developmental disability or delay. Abuse occurs most often within the home, with 91.6% of maltreated children victimized by one or both parents. In 2014, 702,000 people experienced child abuse and neglect. Child victims were similar between boys and girls. Of the reported cases, 75% were neglect, 17% physical abuse, and 8.3% were sexual abuse. 75% of the sexual abuse is inflicted upon girls. The signs and symptoms are composed of 7 domains observed in children who were exposed to trauma. These include attachment, biology, affect regulation, dissociation, behavioral regulation, cognition, and self-concept. Thanks, guys.